can we emphasize on these aspects?
Nine District Governor, 9 MBBS Prasad Garu, District Chairperson for Cancer, 9 Indira Lakshmi Garu, all the delegates from the Lions Club, cabinet members and all the dignitaries from the Lions Club, Dr.P.Mohan, the management trustee of Lions General and Cancer Hospital, Dr. Prasad Garu, the medical superintendent of Lions Cancer Hospital, and the staff of our hospital and other members, invitees. At the outset, let me thank the Governor for giving me a chance to speak to you all. Regarding the hospital, Dr. Mohan vividly described all the details right from the beginning till now. So I am not going to cover any part of that. I will just tell why the name has been given as Cancer Day, what he wanted to know actually. Because we can't put it as a single unit of cancer as a Cancer Day. We can't say prevent cancer, which will cover everything. Treatment cancer will cover everything. Or investigation part will not cover everything. When we say Cancer Day, it includes all the aspects of cancer disease and its management. That is the reason which has been put as Cancer Day. And why people think that the incidence of cancer has increased in the present era than in the previous days. Yes, there are few aspects of the facts which are responsible for having an increased incidence of cancer. One is the environmental factor and adulteration in the food, daily habits which are not conducive to our health, and some of the genetic factors. Many of our change in the lifestyle or lifestyle modification. Basically, all these things are responsible for the increased incidence of cancer at the present state. But there is another issue also. Previously, cancer was not detected so easily. That used to be there because it was not detected as cancer. Though people used to suffer from cancer, but it was not diagnosed as cancer or treated as cancer. So we were missing the cases of cancer, thinking that it's something else than cancer. Just a pundu or kaya. This was the concept what we had. That was the past. But now we know the things, but still, as Dr. Mohan has told, we don't mind spending money in the hotels, eating junk foods, spending a lot of money on cosmetics, and many things which are not conducive to our health. At the same time, we do not spend in the prevention of our health. We do only spend when we come to know, yeah, I am suffering from cancer. Let me run to the best hospital in the world and get treated. That stage only we get the kick of getting treated. But how many of us are really interested to know what are the things we can inculcate as a habit to prevent the cancer? See, one of the factors is the development of technology, even in medical technology, has grown immensely to detect cancer in the early stage, which was not there earlier. some cancers are prevalent in some part of the country. As it was told that oral cancer is common in the coastal areas of Andhra Pradesh and Orissa, and mainly because of the chewing betel nut and other products, and also for the mainly in the ladies for reverse smoking. See, these are the things we know, but how many of people are going to the public, making them aware that these are the things which is causing cancer, do not do this, or keep away from this, not doing. Amitabh Bachchan will go and advertise for these masalas. Shahrukh Khan will advertise for the pan parags. What they are doing? Are they doing good for the country? That should not be encouraged. Even our government, I am not blaming the government, but partly, yes, we insist to write that smoking is injurious to the health and the cover of the cigarette. But neither we prevent manufacturing cigarettes, nor we make the cigarettes are so costly that people cannot reach. Neither of the things. Alcohol price has been brought down so that more alcohol can be consumed. Are we doing good service to the people? All vote bank oriented attitudes. What I want is, this awareness is important. Recently, one gentleman came, he is working in Spain as an IT professional. He brought his father, who is suffering from liver cancer which has spread to the lungs. What is the cause? Chronic alcoholism. See, they did not bother to stop his alcoholism in the beginning or in the middle. Only when the cancer comes, then it becomes whether we should treat or not to treat, because some treatments are very costly. Shall we spend that much money to keep him survive? See, so many factors which come to our mind. But prevention is one of the best things which can be done. As it was told that regular health checkups are very important. You will be surprised to hear one true story. I know everyone must be knowing Dr. Gyaneswar Rao, the so-called professor of medicine in KGH. He retired at the age of 60 and passed away at the age of 63. People used to take 15 days to get an appointment to meet him for the treatment. When others were failing to diagnose the patient's disease, he used to diagnose the patient's disease. And you will be surprised to know, he died of a cancer which was not detected till he died. How surprising. Such a noble man, such a educated and enlightened man who failed to diagnose his own disease condition until his death. That is because of you do not believe in periodical health checkup. That's very important. See, as oral cancer is common in our part of the country, similarly the stomach cancer is quite common in Japan. But then, the results are very good. The reason is, they do a screening, means regular screening of the people after the age of 30 years. They do endoscopy every year. When we do endoscopy, we will definitely localize the lesion and treat in the early stage. Results are very good. and they do a special endoscope which is called chromoendoscope. Chromoendoscope means they spray one time into the stomach and the mucosa there is change in the color. The change in the color of the normal mucosa and the cancer portion will differ. And they used to detect the early cancers. And early cancers, if treated in early stages, results are excellent. In our country, gastric cancer cases, when they come to the doctor, either they are in the third or fourth stage. Even if we offer the best treatment, the longevity and the results, outcomes are not satisfactory. Prevention is very important. We teach in the medical college to the students, even in cancer week and all. We should teach self-breast examination to the females. And that's a very simple method how to do self-breast examination. And if you find any suspicious swelling in the breast, you should immediately meet the doctor. But this month also we are not able to fulfill completely. There are few vaccines which are available to prevent cancers like cervical cancer. Liver cancer occurs, one of the reasons is hepatitis B and C. And vaccines are available against hepatitis B and C. How many people are conscious enough to take these vaccines to prevent cervical cancer? Because the most common cancers in the females are breast cancer and cervical cancer mostly. And those two can be easily prevented if proper preventive measures can be taken. Healthy practice during menstrual period and post-menstrual period, and early consultation with the doctor if there is any symptoms which are not normal will definitely help to detect the early cancers. Similarly, breast cancer is a cancer which is known to occur genetically. Grandmother, mother and daughter, it can be in the families. And this particular thing can be known by simply one test called BRCA1 and BRCA2. Need not be suffering from cancer. And once somebody is known to suffer from BRCA1 and BRCA2, in India, we just take a follow-up. You know what do they do in America? You must have heard of the Hollywood star, Angelina Jolie. She was found to have BRCA1 positive, and immediately she has undergone removal of her both breasts. When there is no breast, how can she get breast cancer? She is free because she has put only the implants. Breasts were removed, skin is there, everything is there. Inside, she has put the implant. That physically, appearance-wise, there is no difference. But she will never suffer from breast cancer because she has taken that prophylactic caution to prevent cancer in her body. Similarly, if proper vaccination against cervical cancer will be taken at a proper age, definitely it can prevent 90% or 95% of cervical cancers. Alcohol prevention. How much we are doing for the prevention of alcohol consumption? We say that fellow is drinking, this fellow is drinking, but what is our role to make them not to become a chronic alcoholic? Have you taken any interest to bring those people to the de-addiction centers to make them leave the consumption of alcohol? Similarly, smoking. smoking does cause lung cancer. Of course, as Dr. Mohan has told that these things that all the patients who are consuming, they do not suffer from cancer. But why do we say that? Because there is a statistical analysis. If 10 people from out of 100 people suffer from cancer of the liver when they consume alcohol, it will be one person getting liver cancer who do not consume alcohol. See, that is the difference, means statistical variation is there. This itself shows that there is a tendency to have increased rate of cancer among the alcoholics and smokers. Similarly, environmental factor, so many spurious gases, especially in the industrial areas and all. No proper preventive measures or cleaning procedures have been done. We are not bothered. Because we bother only when we suffer. Until then we keep quiet and see the people suffer. So many things which can be prevented should be practiced, especially the enlightened or knowledgeable people should see that less people suffer from disease and cancers. This is not the part of the prevention. Let me tell you a few things about the diagnostic. Advancement in the technology for detection of the cancers. There are some tumor markers. It's a blood test where we can know a person can develop some of the types of cancer, not all types of cancers. Not only that, as I told, endoscopy, a regular endoscopy, regular ultrasound, or regular health checkups will definitely help us to detect the early cancers. But once the cancer is detected, earlier we did not have this CT scan, MRI scan or PET scan to assess the extent of spread of the disease in the body. But now we have all these gadgets or techniques where we can know the stage of the cancer and appropriate treatment can be done. Some of the cancers which are hormone related, like thyroid cancer, or some cancers are called neuroendocrine tumors. And these things can be detected simply by doing blood test and assessing a particular type of hormone. Even some cases, we can detect cancer by examining the urine. For example, carcinoid tumor. If you suspect a carcinoid tumor, if you examine the urine of the patient, there will be elevation of the 5-hydroxyaldoleic acid. And this thing can be known in an early stage itself. Many diseases where detection can be done in early stage. For that, we need to have health consciousness, awareness, and to desire to have a healthy life. Similarly, the diagnostic modalities have immensely increased by which we can detect all the types of malignancies, including blood cancer or lymph node cancers, liver cancer, pancreatic cancers, or any solid organ cancers, brain cancer, lung cancer, any of the cancers. Similarly, when you come to the part of the treatment modalities also have improved. Earlier we are doing only surgery and crude method of radiotherapy and some few medicines, chemotherapy. But we have now advanced technology of surgical techniques by which can be precise surgery can be done and total removal of the cancer from the body, and following that we give chemotherapy and radiotherapy to kill the cancer cells which are present in the body. Because it's not only the tumor which has got cancer cells, there may be spread of the cancer cells in the bloodstream or lymphatic system. To kill all those things, we need other modalities of treatment like chemotherapy, hormone therapy, targeted therapy, immunotherapy, modulated therapy, so many things which have come into the practice with varied results. Of course, some of the treatments are prohibitively cost, but people who can afford, they can have those modalities of treatment. So treatment methods have increased, diagnostic modalities have increased, and preventive measures also available. But what is important is we should make others aware of the facts that these things we have, and we should utilize the services. And I request all the people to have a sympathetic attitude toward the cancer patients, because why I am telling this, common people, they are reluctant to come to Lions Cancer Hospital even to buy medicines. The reason they think that cancer is a contaminating disease. They feel that if they come to cancer hospital, they can get cancer. This concept should be wiped out from the common people's mind. It is not transmitted by contact. It is transmitted by other means, not by contamination or contact. This concept also should be made aware to the common people. There is a lot of things to describe in a detailed way. And thank you for giving me this opportunity. If anybody individually wants any clarification, I am there to clarify. Thank you.